Welcome to our first module. In this first lesson, we're going to explore the knee and talk about what arthritis really is. Having a simple, basic understanding of the knee joint is extremely important if we want to effectively address and reduce knee pain. By the end of this lesson, you'll have a clearer picture of how the knee works and what's actually happening when arthritis develops. The knee is a complex joint made up of three main bones: the femur, which is your thigh bone, the tibia, which is your shin bone, and the patella, or the kneecap. These bones are held together by ligaments, which provide stability to the joint. The knee is also cushioned by cartilage, which helps absorb shock and reduce friction during movement. Finally, the knee is supported and moved by muscles and tendons that surround the knee. When we talk about knee arthritis, we're mainly focusing on the connection between the femur and the tibia. So let's start there. Osteoarthritis, or OA, is the gradual breakdown of cartilage between bones. In the knee, cartilage covers the ends of the femur and the tibia, and we also have the meniscus, which acts as a shock absorber. When osteoarthritis develops, this cartilage and meniscus begin to wear down. As that cushioning decreases, the bones can start to rub together. This often leads to pain during everyday activities like standing, bending, squatting, or going up and down stairs. Osteoarthritis exists on a spectrum ranging from mild to moderate to severe. If you're experiencing symptoms, it's important to see a healthcare provider in person to assess the severity and rule out other causes of pain. While we can't reverse osteoarthritis in physical therapy, we can often reduce pain and significantly improve function, especially in mild to moderate cases. So how do we do that? First, by strengthening the muscles around your knee and your hip. Strong muscles in the knee help absorb force when you walk, climb stairs, or perform daily activities, taking stress off the joint itself. We also focus on strengthening the hip because the hip controls how force travels down into the knee. When the hip muscles are weak, the knee often has to compensate, which can increase joint stress, irritation, and pain. Improving hip strength helps with alignment, balance, and movement control, allowing the knee to work more efficiently and comfortably during everyday activities. Second, by improving joint mobility. Better mobility gives your knee a greater pain-free range of motion, making it easier to bend and straighten during everyday tasks. Now that you have a better understanding of what's happening inside your knee, let's move on and talk about what you can do at home to improve strength, mobility, and overall comfort. But first, let's take a moment to talk about things to avoid, as this often is a point where many people get stuck.